I was at work and I called my sister. I said, hey, I got a little headache. And I said, I'm gonna sit down for a minute. I woke up and I was at Ben Taub. And I had aneurysm, seizures and stuff and all that. That was my first time it ever happened to me. My kidney was doing pretty bad. I couldn't remember my memories. I didn't know my people.
A lot of people use the words health and healthcare interchangeably, and they're not the same thing. Our real goal ought to be about health. Healthcare is a piece, it's an important piece, but it's only a 20% factor. And factors like housing and housing stability and access to food and job training and all the other things that together combine to make a person's life healthy, that's collectively more important than healthcare by itself.
Having a stable place to live, having a foundation from which to launch from is what positions us to handle everything that life has to throw. And when we don't have those things, it really takes a substantial toll.
One time I'm staying in this abandoned trailer, but I had a bunch of quilts on top of them to keep the mosquitoes from eating me alive. And man, I be up on this summertime and I'm sweating and but I can't sleep without the blankets because the mosquitoes gonna eat me up,
I talk about affordable housing as, the first rung on the healthcare system. And I ask them the question, have you ever seen a healthy homeless person? And the answer always comes back, no. I said, we are the first rung of that ladder.
It just allows people to feel safe, to not be exposed to the negative impacts of the natural environment like heat, mosquitoes, violence. It allows them the space to actually engage in their health and health care because they're able to establish routines and have some certainty in their life.
I think the average person who sees a homeless person assumes somehow that guy's problems are all his. But of course, that's not true at all. If you live on the street, several things happen to you. One is you get sick. And when you get sick, where do you suppose you get medical care? At the emergency room. On average, that costs $3,700. Well, we can house somebody for a year for $6,000 to $8,000. We don't bring the homeless people to a neighborhood. We house them once they're there. We're the solution to homelessness, not a purveyor of homelessness.